Let's talk about cholesterol, the interesting topic that's so controversial out there. Certainly, if you scour the internet, searching on YouTube, maybe you might even look up AI, ChatGPT, or Bard to try to find answers or solution or what does it mean, because doctors are freaking us out about high cholesterol. And so many people are put on cholesterol lowering drugs because everybody absolutely knows that cholesterol causes heart disease, right? Well, I'm going to tell you something different. I'm going to actually tell you some interesting information that nobody's saying out there, because I think that I've put it all together quite well. So this is definitely going to be a comprehensive guide and understanding cholesterol, but I want you to get the right information, especially towards the end of this video. It's going to make a lot of sense to you. So let's get into it. We're going to talk about what is cholesterol, is it bad or good, what does it mean if it's high or low, and what type of testing should you do with cholesterol. So let's get back into it. Oh, by the way, my name is Dr. Augustine from the Dr. Jim Cares podcast. So we're going to be talking about the topic of cholesterol. I don't want to say I want to put it to bed, but I really want people to understand what's really behind this. So cholesterol, it's a waxy fat-like substance that's essential for the body. Interesting. Essential for the body. It's used to make cell membranes. How many cells in your body do we have? 40 to 60 trillion cells. It also is critical for making your hormones as well as vitamin D. It's also really, really critical for brain function. Your brain is over 60% cholesterol type fat, so really, really essential. And there are two main types of cholesterol that's talked about. LDL cholesterol, which is supposed to be the bad cholesterol. It's the cholesterol that's taken away from your body to go out to your tissues. And then there's the HDL, which is categorized as the good cholesterol that's brought back from your body tissues back to the liver. Notice that we talked about the liver. The liver is really what makes cholesterol for your body. So keep that in mind, that your liver sends it out, LDL cholesterol, and HDL brings it back. And by the way, LDL stands for low density lipoprotein. It's actually a protein that carries this fatty substance on it. All right? So cholesterol levels can be affected by a number of factors: diet, certainly, genetics, lifestyle, those sorts of things. And here's the difference. Here's one of the nuances that's a very specific difference. Eating a diet that's what? High in starch, sugar, as well as drinking alcohol raises your cholesterol levels, especially LDL and some other factors within LDL cholesterol that can indicate what's causing it. So this is the key. You notice that I didn't say saturated fat and red meat, because that's not so good. Eating saturated fat and red meat isn't actually correct. I mean, it can raise it a little bit, it can raise it some, but it's not the key factor here. And this is the important points that we want to talk about later. And don't worry, we're gonna get there. We're gonna get there. So you can raise, like I said, you can raise cholesterol a little bit with some saturated fat and red meat, but it's not the big deal at all. The interesting thing is what is recommended out there, you know, as far as how do you lower your cholesterol. Let's talk about that for a moment. How do you lower it? Lowering cholesterol, and this is what you can search on the internet. It says exercise regularly and maintain a healthy weight can help to lower your LDL cholesterol and raise your HDL cholesterol, right? The good cholesterol. So what's the best way to lose weight and maintain a healthy weight? It's not exercise. You would actually have to run 26.2 miles to burn 1 pound of body fat. And you really don't want to lose weight, you only want to lose body fat, right? Because go to the mall, go to Disneyland, and as you look around, everybody is over body fat. They have way, way too much body fat. So here's the key. What puts on body fat? How do you maintain a good weight? And really, it should be body fat. What puts on all that body fat is starch, sugar, and drinking alcohol. It's not eating protein. Matter of fact, you've maybe heard of the Atkins diet, and you've heard of some of these other diets, the carnivore diet, the ketogenic diet, which is low in starch and sugar. And of course, you want to avoid alcohol anyway, because it's liquid sugar to your body. These are the hardest substances on your liver that makes your cholesterol. Beat up your liver, raise your cholesterol. Okay, get that? By the way, what things actually cause heart disease? Eating sugar, starch, drinking alcohol is what causes heart disease. Yeah, certainly smoking. Not as many people smoke today as they used to. They once did. So let's ensure, I want to make sure you wait to the end of this video to really get the bigger picture here. This is what's so important, so bear with me. So is cholesterol good or bad? Cholesterol is absolutely not bad. It's absolutely essential for your health, as I said earlier. It's critical for all of your cell membranes, hormones, brain function, all of that good stuff. In my opinion, based on the available data, that cholesterol is similar to blood sugar or blood pressure, let's ask the right question here. What causes it to go up or down? Since the concern is when it's high, and more specifically, your LDL cholesterol, which is supposed to be the bad cholesterol, when it's high, what's causing it and what does it mean? Good questions there. Total cholesterol. Let's talk about some blood panels. Okay, what type of a blood panel should you do? It's called a lipid panel, and many doctors, if not most doctors today, will do a lipid panel of blood work on you. So this is total cholesterol, LDL cholesterol, HDL cholesterol, and triglycerides. Those are the standard tests that are done. I would also have your doctor, if not your doctor, me, include the ratios. And the ratios actually look at heart disease risk. That's what the ratios are for. So there's a total cholesterol to HDL ratio, and a ratio of less than 5 is considered to be healthy. And these are the standard ideas about the ratios and the lab ranges that I'm giving you now. LDL cholesterol to HDL cholesterol ratio. So a ratio of less than 3 is considered to be healthy. And then we have triglyceride to HDL cholesterol ratio. And that ratio is a ratio of less than 2 would be considered healthy. Now, important, and this is where I would maybe take some notes on this, write this stuff down. What other markers should you include in your blood work to really know what's going on and if you really are moving towards heart disease risk, okay? Number 1, fasting blood glucose. It's kind of a standard one that's done. So a normal fasting blood glucose level is about 100 milligrams per deciliter. A level of 100 to 125 is considered pre-diabetes, and a level of 126 or higher is considered to be diabetic. Hemoglobin A1C, or your A1C test as it's called, you've probably seen commercials on that as well. What that means is it's the last 3-month average of your blood sugars, all right? So let's talk about that. A level that's less than 5.7% is supposed to be normal. I would say, I'll give you a little different option on that. I would say we want it to be 5.4 or less, ideally. A level of 5.7 to 6.4 is considered pre-diabetic, and then a level of 6.5 or higher is considered to be diabetes. Now, C-peptide. C-peptide is some of the other included, or you should have included these markers in your blood work. C-peptide is a hormone released by the pancreas when insulin is produced. So how much insulin is being produced is what you want to know. A normal C-peptide level is more than 1 nanogram per deciliter. Fasting insulin, another marker that's important. Fasting insulin. How much insulin is in your body after fasting? So normal fasting insulin level is less than 10 units per milliliter. A 5th test that you want to do is called HOMA-IR, HOMA-IR. And this value is called, what this means is homeostasis model assessing insulin resistance. It's a measure of insulin resistance, basically. So a normal level of this is 2.5. These last two are really, really important. ApoB, or apolipoprotein B, and it's a measure of the total amount of LDL cholesterol in your blood. ApoB is a protein that tags along on your cholesterol, on your LDL cholesterol. So a normal ApoB level is less than 100. But here's the one that I really like, and you definitely should include this, is the LDL patterns, the pattern of LDL cholesterol. And basically what they do is it classifies the LDL cholesterol based on its size and its density. And here are the patterns. Pattern A and B are the ones that you really want to pay attention to. Pattern A is the most desirable pattern. It's the big, fluffy, large particles of LDL cholesterol, and it's very buoyant. It floats really well. So if you have a pattern A LDL cholesterol, and let's just say your cholesterol is 500, it really doesn't matter if you're pattern A, if it's 500. It could be 900 and it wouldn't really matter, because none of that is going to stick inside your blood vessels and cause problems. It's the pattern B, the small dense particles that can wedge themselves between your endothelial cells that line your blood vessels. So that's the bad. LDL pattern B would be the bad pattern. And I bet you that your doctors do not test for this. They just test your total cholesterol and LDL cholesterol, and they say, well, it's too high, here's a statin drug. What if it's pattern B? What if what if it's pattern A, the big fluffy particles, and what if your apolipoprotein or ApoB is really, really low? Do you need to be on a statin drug? No. Do you need to be on a statin drug anyway? Because does cholesterol cause heart disease? So let's look at now some important observations. And this is maybe some items to ask your doctor, ask ChatGPT, look this information up. Who discovered the cholesterol ranges? You know, that range that cholesterol should be less than, your total cholesterol should be less than 200. Where do these ranges come from? Good question. Maybe ask your doctor that. What raises cholesterol? My answer would be starch, sugar, and alcohol. Let's ask another question. What is the structure of the government recommended diet? You know, the food pyramid diet? What is the base of it? It's grains. It's starch. In the center of it is very little protein. At the very tip top is hardly any fat. Okay, so remember that, right? Lots of starch and sugar at the base, a little bit of protein, hardly any fat. All right? And we have, here we go, let's look at this observation. We have, as a nation, significantly removed saturated fat and red meat from our diet. And yet, heart disease is not only the #1 killer today, but it's dramatically worsened over 30 to 40 years. Even so, we've removed saturated fat from our diet and red meat. So how can it be worse? More very important observations here. Now watch this. Looking more closely at LDL cholesterol, and we want to look at these markers that we just talked about. ApoB, what raises it? What raises your apolipoprotein B? That's a really significant marker for heart disease. Starch, sugar, alcohol. What raises pattern B LDL cholesterol? Starch, sugar, alcohol. Low insulin equals pattern A LDL cholesterol. Low insulin. So what's my point here? What am I getting at? The large fluffy particles are not associated with heart disease. How would you keep insulin low? And here's the key: by not eating starch, sugar, and not drinking alcohol. Point number 2. Since eating starch, sugar, and drinking alcohol raises cholesterol, and more specifically LDL cholesterol, because they're the hardest items on the liver beside drugs, these items are what cause heart disease, not cholesterol. Okay, so again, watch this. What causes heart disease? Eating starch, sugar, drinking alcohol. raises blood sugar. Diabetics, pre-diabetics are destroying and damaging their heart and blood vessels. But what also raises cholesterol, starch, sugar, and alcohol. And every aspect of bad LDL cholesterol, what raises it? Starch, sugar, and alcohol. Happens to be present at the same time, but cholesterol doesn't cause heart disease. So some people will ask the question, well, what's that plaque then that develops in the arteries? They go there and there's cholesterol there. Well, actually what's in the center of it all is oxidized seed oils, omega-6 oils, and oxidized fats, the bad damaged fat. Guess what oxidizes the fats? Raise your insulin level. Well, it raises insulin, starch, sugar, alcohol, and it does the damage there. Do you get this? Please understand this. It's super, super important. So in summary, let's go over a summary now. Cholesterol is an indicator of a change in physiology in your body. So ask the question, what's causing it? What is causing it? Is it directly causing heart disease? I say no, based upon the evidence and based upon all of this data, these markers that we're talking about. And to keep it in check, reduce, but even eliminate starch, sugar, and alcohol from your diet to keep insulin low and no heart disease, assuming that you're not smoking and doing other things like taking drugs. That's my summary. Hope this helps. Hope this makes a lot of sense to you. Look at that at the end of this video again and just go over it again to get this picture. Okay, really, really important. I hope this helps. If you have any questions, comments, you need any help with your health, please let me know. You can contact me through my email address. It's draugustine@gmail.com. My phone number, office phone number, 562-860-3404. I'd love to chat with you. You can leave comments in this video below. I'm on social media, TikTok, Instagram, as well as, I'm actually on Facebook too, as YouTube. So I do YouTube videos. I am also on podcasts. I have an Apple, Spotify, and Google Podcasts. I'm on there as well. Please like and subscribe. It really, really does help the channel and get this real good, truthful information out to many, many people. So that's it for me. My name is Dr. Augustine from the Dr. Jim Cares podcast, and we will see you all next week. Have a great day.